Hello, everyone, and thank you for joining this webinar on the California Opioid Settlements Annual Expenditures Report for State Fiscal Year 23-24. My name is Chelsea Kelleher, and I work for Aurora Health Group, and we will be helping the Department of Healthcare Services facilitate today's webinar. Next slide. Few housekeeping items before we get started. During this call, if you have any technical difficulties, please send a direct message to Abina Asari from Aurora Health Group. She can help you troubleshoot any issues. Today's webinar will provide an opportunity for questions. The HCS team will be focused on questions that are applicable to the recently published annual expenditures report. If you have questions that fall outside of that annual report, we recommend contacting DHCS via email. We'll be sharing that email throughout the presentation today and at the end. And today's meeting materials will be made available. They'll be posted to the DHCS OSF webpage within the next week. Next slide, please. Today, your presenters will be Sandy Snellgrove and Jenny Davis from the Community Services Division of DHCS. This is the division that is tasked with monitoring expenditures and reporting requirements for funds received from California's opioid settlements and bankruptcies. Before I turn things over to them, just a few additional details that I'd like to share. Next slide, please. For our agenda today, during the webinar, DHCS will provide an overview of the purpose of the annual report and today's meeting. The team will then provide some background on California's opioid settlements and bankruptcies. DHCS will provide an overview of the annual reporting process and key findings from the annual report, including payments and expenditures for state fiscal year 23-24. And we will end today's session with an opportunity for Q&A from the participants. Next slide, please. I do see some raised hands already. Just to note that we will be taking questions at the end of the presentation, but you are free at any time to type your questions into the chat. Just a quick disclaimer before we get started. We know that many of you are new to this work and opioid settlements broadly. So this presentation does include summaries of those legal agreements with opioid manufacturers, distributors, and other entities. In the event there are any discrepancies between today's presentation and the language in those agreements, please know that those agreements supersede. Our presenters will be distilling those important points from the legal agreements to provide some background information for those joining us today. Next slide, please. I'll turn it over now to Sandy Snellgrove from the Department of Healthcare Services, who will walk us through the purpose of the annual report and overview of the opioid settlements and bankruptcies. Sandy is the branch chief of the Community Support Branch at DHCS, which is tasked with overseeing use and reporting of settlement funds among the cities and counties. So I'll hand it over to you, Sandy.
Thank you, Chelsea, and thank you for the introduction. Good afternoon, everybody. This is our second year presenting, drafting, first of all, and presenting the annual report. And so we have found that in our experience, it's always really important to provide just a tidbit of background information on the opioid settlements and some updates on opioid settlements in the event that we have individuals on the meeting that aren't necessarily familiar or completely familiar with the background on those. So we'll jump right into that. Next slide, please. So about the annual report, California and all of its participating subdivisions, that's all the California participating cities and counties that are receiving funds from the opioid settlements and the one relevant bankruptcy are required to complete annual reporting to DHCS. As a result of those reports and pursuant to the California specific state subdivision agreements, DHCS will prepare an annual report regarding the state's use of those funds. And we do that and will do that until all of those funds are fully expended and for 1 year thereafter. That means all of the cities and counties reports until their funds are fully expended, and that 1 year after, DHCS will continue to prepare the annual report. After the preparation of that report, DHCS will make that publicly available. The website will be provided in the chat for everybody, where those reports from both the cities and the counties that are participating, as well as the big broader California aggregated report, will be published on the DHCS website. And then with that said, we have the obligation after that publishing, or even before, but to present that report on a meeting, which is what we're doing today. Next slide, please. So diving into a little bit of the background of the settlements and bankruptcy agreements. Next slide, please. So it gets a little complicated here, and I'm going to do my best. These are the actual agreements that are to date, and where DHCS has a role in that oversight. And so, listed in that one column where it says full oversight, these are settlements that California has reached between Allergan, CVS, the distributors, Janssen, Kroger, Mallinckrodt, which is a bankruptcy, McKinsey and Publicis, Teva, Walgreens, and Walmart. You'll note that McKinsey says states only, and the reason is because California DHCS has full oversight of the McKinsey settlement that was very specific to states, not those class action settlements that were between cities and counties in California. Those payments are being done separately, and those settlements are done separately from the McKinsey payments and the settlement that was done specifically with California. Publicis, similar. However, payments for the Publicis settlement aren't going to cities and counties. They're very specific to only states. And so California has received payments from Publicis, and they're included in the report, just like McKinsey, as it relates to payments coming to California for state-directed opioid remediation uses. To complicate things further, there's also partial oversight, and that is there is a new bankruptcy, which is Indo, and there are payments that are going directly to cities and counties, as well as payments that are coming to the state of California. And those payments that are going to cities and counties are not included in this report because there was no oversight granted to DHCS as part of these settlements. Same thing with the McKinsey class action settlement, that those payments are going directly to cities and counties, and DHCS has no oversight of those settlement agreements. Next slide, please. So in the negotiation of the national settlements, all of those at the table really took into consideration the big tobacco settlements from the 1990s. Those settlements did not require necessarily or very specifically that the funds received from the settlements would be used specifically for opioid remediation. And so taking the lesson from those big tobacco settlements, where a lot of the funds were used for administrative expenses as well as to fill maybe general budget gaps, but really not getting out to where it needed to be, including supporting folks with smoking cessation and those injured as a result of the tobacco industry. The national settlements really kind of honed in on the opportunity to restrict those funds specifically to opioid remediation. That was defined in the national settlements to like care, treatment, and other programs and expenditures, which really would address the misuse of opioid products, mitigate any other alleged effects, but also to treat or mitigate opioid use or related disorders. Next slide, please. So as part of the national settlement agreements, settling states were also allowed to work specifically with their participating and eligible cities and counties to negotiate per se an allocation and structure to those settlements. And so in the national settlements, a list of approved uses was established, which is referred to as Exhibit E. And this is very specific, a list of approved uses in the national settlements. And it's broken up into two areas, which is Schedule A, which is a short list of core strategies. And then Schedule B is a longer list of those many types of opioid remediation activities that would be allowable. Important to note, too, that they're quite duplicative. Really, those things that are listed in Schedule A, those core strategies, are also listed in Schedule B, but they were really pushed up to really bring to everyone's attention that these are some core strategies that there was a belief that they would be most effective and probably have the most immediate effect on the opioid crisis. Next slide, please. This is the list. I won't pull us through this extensive list, and all of this is available on the DHCS website. But these are the core strategies that are listed in Schedule A. Next slide, please. And then this is the list of Schedule B approved uses. Just so you're aware, these are the major categories in Exhibit A. However, there is a much longer or more descriptive list of activities that are listed under these approved uses. Next slide, please. And as I mentioned, each of the settling states were given the opportunity to establish how the settlements would be handled at the state level, including those uses and allocations, and which then took to further restrict what was provided in the national settlements. So we'll jump into a background on those. Those are called the California State Subdivision Agreements, and they exist for all of the settlements. Next slide, please. So, as I mentioned, as the national settlements were finalized, the states, including all of their eligible subdivisions, again, that's the cities and counties, had the ability to structure their settlement allocations and further define how they would restrict the uses of those funds. California and the council representing a group of cities and counties reached an agreement to further define those uses and those allocation of payments. And those were referred to or are referred to as the state subdivision agreements. One thing that we try really hard to do on the DHCS website is to really sort of direct individuals to look at the state subdivision agreements, because in California, there's the national settlement agreements, but these state subdivision agreements, again, went on to further restrict the uses specifically to those identified in Exhibit E, and then also determine how those funds would get allocated to the state. So they're a really critical piece when you're reviewing how those settlements are being structured in California. Next slide, please. So the state subdivision agreements took all of the payments coming from the manufacturers in each of those settlements and allocated them as 70% to the California Abatement Accounts Fund. The recipients of those are California participating subdivisions. You'll hear us go back and forth, but just for reference throughout the slides, California participating subdivisions are those cities and counties that signed on and are receiving payments from the settlements, or may not be receiving because they opt out of receiving payments. But these are all of the participating cities and counties in California. So that 70% goes to the participating subdivisions. Those funds must be used for opioid remediation, specifically in one or more of the areas listed in Exhibit E. And that is linked here. Again, it's also available on the DHCS website. But that 70% must be utilized by cities and counties specifically to an activity that is actually listed in Exhibit A. Additionally, there's 15% that goes to the California Subdivision Fund. This went to those initial plaintiff subdivisions. Those are the subdivisions that were involved initially in the litigation. And those funds must be used towards future opioid remediation and to reimburse, and can be used, of course, to reimburse past opioid-related expenses, which may include litigation fees and expenses. And when we look at these funds, this goes back to that definition of opioid remediation as it's identified in the national settlements, which would be for the care and treatment of individuals, opioid misuse, and substance use disorders related to opioid use. 15% of those funds went directly to the state of California. Those funds must be used for future opioid remediation. So there's no other restrictions on those funds other than that all of the funds that come to the state of California must be used for opioid remediation activities. Next slide, please. So this is complicated, but I did mention plaintiff subdivisions, and these are those subdivisions that are located in California. They filed a lawsuit on behalf of that subdivision, on behalf of the subdivision or the people of the state of California against one or more of the opioid defendants. And those are those initial plaintiff subdivisions that filed those lawsuits prior to October 1st. because they're also participating subdivisions throughout the annual report, as well as through this presentation. When we're referencing plaintiff subdivisions, we're also referencing them as participating subdivisions because they are also in receipt of that 70% of the allocation, in addition to the 15% they get for being an initial plaintiff subdivision. Next slide, please. So there are some additional expenditure requirements for the California Subdivision Fund, and that is that there are reasonable and related administrative costs. Those should not exceed 10% of the total amount that they've received. And if funds are ever placed in interest-bearing accounts, any interest earned on those funds are required to also be used for opioid remediation activities and also have to be reported annually to DHCS. On the subdivision fund, there are no imposed expenditure timeframes per the SSA, but funds may be used to reimburse past opioid-related expenses. So they have some additional things that they can utilize those funds for because of being an initial plaintiff subdivision. Next slide, please. For the 70% on the California Abatement Accounts Fund, total indirect cost, meaning those related administrative costs, but we consider those to be direct costs that are related to an eligible opioid remediation activity. It cannot exceed 10% of the total amount allocated to an activity. So if a city or county is allocating money specifically for an eligible activity, the administrative costs for that or the indirect costs cannot exceed 10% of that actual funded activity. Any funds placed in interest-bearing accounts, again, must also be used for opioid remediation activities. And the different expenditure timeframes here is that unlike the subdivision fund where there's no restrictions on those expenditure timeframes, these 70% abatement account funds must be encumbered or expended within 5 years or 7 years if it's for a capital outlay project. In addition to those requirements, 50% and no less than 50%, I should say, of funds received in each calendar year shall be used for one or more high impact abatement activity. So of the 70% from each settlement that gets allocated to a participating subdivision, they must use those funds specifically for an activity listed in Exhibit E. But in addition to that, they must also use 50%, no less than 50% of those funds on a high impact abatement activity. And I promise I'm about to get into those. Next slide, please. So I had already mentioned that in addition to the way that the funds were allocated in the state, that 70, 15, and 15, there are restrictions on funds to Exhibit E activities. And in the negotiations of those opioid remediation negotiations related to those activities, the state of California, along with council that represented cities and counties, agreed on a list of high impact opioid remediation activities that would be prioritized in California. And those activities must also align with Exhibit E. These priorities were informed by California's opioid remediation needs. And really, the intention of these high impact activities is not only to utilize the funds for an Exhibit E activity, but also then to prioritize or direct those funds to services for populations that have been disproportionately impacted by the opioid crisis. So again, per the state subdivision agreements, no less than 50% of those funds must be used for a high impact abatement activity in each calendar year. And again, those high impact abatement activities must also first be prioritized in an activity that's listed in Exhibit E. Next slide, please. This is the list of California's high impact abatement activities. 1 through 5 of this list is listed in the state subdivision agreements, but as part of DHCS's oversight and authority, through stakeholder consultation per se, we can add to this list, which we did in, I think, a meeting that we hosted within the first year. We received an over 90% consensus to add high impact abatement activity number 6. So you'll find that in DHCS policy, but not listed in the state subdivision agreements. And I won't read the list in its entirety. These are all available in state subdivision agreements and all of the available resources that we're going to provide at the end of the presentation. Next slide, please. So one difference is that to the settlements, there's a bankruptcy, it's Mallinckrodt bankruptcy, and that is a statewide abatement agreement. So same thing, bankruptcy at the national level, and then the settling state establishes with its council and California Council and council that's representing the cities and counties established the California statewide abatement agreement, and this is very specific to the Mallinckrodt bankruptcy. Next slide, please. Going back to the national bankruptcy, California established the California statewide abatement agreement. And to further complicate things, of course, is that some cities did not receive payments from the Mallinckrodt bankruptcy because they were connected directly to how a city or a county may have elected to receive their payments in the national distributors settlement. And so if a city did not elect to receive the direct payment in the national distributor settlement, then the funds from the Mallinckrodt bankruptcy were automatically distributed to the county in which that city is located. So payments were made by the National Opioid Abatement Trust, referred to as NOAT2. And for awareness, I'm not sure if this is in my next slide, but Mallinckrodt filed for bankruptcy and then throughout the first year failed to make their second payments and went on to file a second bankruptcy. And so if I'm correct, I believe 2 payments have been made to California and its cities and counties from Mallinckrodt. And at this time, no other additional payments are expected. Next slide. So in that statewide abatement agreement, similar to the settlements, there was determination on how those funds would be allocated. The state share, which is 40%, that went directly to the state of California, and that must be used for future opioid remediation activities, listed in Exhibit 4 of in the Mallinckrodt bankruptcy. Just so you know, that's exactly the same as Exhibit E, so I'm just going to say Exhibit E. And then the local government share, this is the local governments, which are referred to differently, but they are still participating cities and counties, would receive 60% of those funds. Both the state as well as local governments were required to use those funds for activities listed in the categories of Exhibit E. This one has no high impact abatement requirements, just that they're used for activities specifically identified in Exhibit E. Next slide. For the additional expenditure requirements for local share, Mallinckrodt national agreement, and if I'm correct, also carried into the statewide agreement, that total indirect cost would not exceed 5% of the total allocation. So you'll see that these are further restricted on the amount that can be used for administrative cost. And just so you're aware, no matter the settlement or the bankruptcy, all indirect or what we would consider to be indirect or administrative cost must be reasonable, and they must be related to a specific eligible activity. So there can't be any indirect or administrative costs that aren't related to administering an eligible opioid remediation activity. Same thing, any funds placed in an interest-bearing account, any interest earned shall be used for eligible opioid remediation activities. For the expenditure timeframes, there is no expenditure timeframe stated in the abatement agreements, but funds really should follow this similar expenditure timeframes. And what I do want to point out is that Mallinckrodt is no longer making any payments because of their bankruptcy. But they do have separate reporting requirements. And so whenever cities and counties, I'm sure you've noticed when filing your report with DHCS, there's sections specifically to the settlements. And then there's one separate section very specific to Mallinckrodt. And it's because it has separate reporting requirements. So the sooner that you expend your Mallinckrodt funds, the sooner that you no longer have to fill out or have the administrative burden of completing an additional report to DHCS. So if you're expending the funds, expend your Mallinckrodt funds. They, even though they don't have timeframes, but they do have those separate reporting requirements, which we've heard have become a little bit of an administrative burden for cities and counties. So, and as I mentioned, for the allowable expenditures, they shall be used for activities that are aligned with those listed in Exhibit 4, which is Exhibit E. Next slide, please. So this is the annual expenditures report process. So a lot of people ask, like, well, what happens once the reports have been submitted to DHCS? I'll jump into that a little bit. Next slide, please. So DHCS established some expenditure periods. We did this based on stakeholder feedback, put it on a state fiscal year, which is July 1st of each year through June 30th. And then what we do is that's the expenditure period, and then we open up the reporting period on July 1st following that expenditure fiscal year. And then we close the annual reporting period on September 30th of each year. So cities and counties are required to submit their annual reports to DHCS, which would include all the payments received and activities that you funded with your opioid settlement funds. And that would all be for the previous state fiscal year, or what we would call the expenditure period. So the online reporting form is emailed out to everyone from each city and county that's listed as a contact with DHCS. We have a whole process for that. So take note that if your city or county ever has a change in staff or who will be administering or overseeing those funds, always good to reach out to DHCS to let us know, so that link for the report specifically for your city or county is emailed to you at the end of the expenditure period and is available for you to open up and file your report. We again send those out at the beginning of the reporting period, which is July 1st, and those links close on September 30th of each fiscal year. Next slide, please. So this is where DH's our role comes in, sort of report monitoring. So we receive the report from cities and counties. We're available for technical assistance. We also host office hours, so also important to keep updates, to keep contacts updated with DHCS, because we host each year any updates to the annual reporting form. We'll host a webinar related to that. And then in addition, once the reporting period opens, we'll host office hours that allow for cities and counties to come on and just ask very specific questions so that we can support you in filing your annual report. So once the report is filed, if DHCS identifies any corrections needed, one of the DHCS analysts assigned to your city or county would contact the city or county to request corrections. And then typically during those meetings, we're also providing technical assistance, hosting any meetings needed to just really get the reports to a place that they can be finalized. And so we'll send you a revision link after those meetings, and that city and county would then revise and resubmit their report. If DHCS receives the report and identifies no corrections are needed, then DHCS contacts the city or county directly, confirming that the report has been accepted. Next slide, please. Um, so again, like I mentioned, any city or county that's instructed to correct their report will receive technical assistance. And we do that because we want to ensure proper documentation of expenditures. And to note any failure to remove or correct inconsistencies in financial tracking, unallowable uses and expenditures, or other incorrect reporting may result in an audit and a meet and confer and legal action from DHCS. We have created a pretty comprehensive technical assistance process and really want to work diligently with cities and counties to ensure that expenditures are, first of all, allowable and eligible prior to their use. And all of this information is available on the DHCS California Opioid Settlements webpage. We just want to make sure that we're here, we're supporting you. We understand that these are very complicated settlements. There are more coming, and those will have a slight difference in how the subdivision funds are tracked. And so we're here to support you. We also want to make sure that when you're reporting to us that your tracking is also correct, and that we can support you and really just get away from having to go into any kind of a meet and confer or an audit whatsoever. Next slide, please. So once DHCS has received all of the submitted reports and they're all accepted by DHCS, we start the analysis so that we can draft this annual report that we're presenting on today. So we utilize a couple partners to support DHCS with this. So our data is collected by UCLA's Integrated Substance Abuse Program and then prepared for the annual report by DHCS. And we utilize Aurora Health Group, who's on this webinar with us today, to really support us with drafting this report as well. The data analysis that is included in that, and that's ultimately summarizing the payments by what fund and share and beneficiary, also summarizing the expenditures by exhibitee activities, high impact abatement activities, and the 3 other opioid remediation categories. And then also totaling all of the administrative and indirect costs and past legal expenses. Again, we then go on to review narrative descriptions of activities to identify and ultimately highlight what we are seeing as some promising practices across the state. We're doing that because we want, not that it's an obligation by DHCS, but we really want to support other cities and counties in seeing activities that were administered by some cities and counties that are considered promising strategies. Next slide, please. All right, I think that ends it for me, and I'm going to introduce and turn it over to my colleague, Jenny Davis. Jenny is the section chief of the opioid settlement section, really the boots on the ground leader of all work that's related to California's opioid settlements, and probably the best SME in all of this, especially as it relates to payments and reporting and all of those important things that we're going to be going through today. So, Jenny, I'm going to turn it over to you.
Thank you, Sandy. Can I get a quick confirmation that everyone can hear me? Okay, we're looking good. So the second half of this presentation and what is ultimately my job is to basically take everyone through some of the key data elements that we have in our published 23-24 report. I am seeing some folks in the chat saying that link is not working for them. I will say my computer is also being a little funky right now. So I think DHCS is doing some updates right now. So just bear with us and try the link later. We do promise that it is published, and hopefully that gets resolved quickly so everyone can take a look at the report. Next slide, please. So in state fiscal year 23-24, California received over $234 million from the opioid settlements and bankruptcy. Of this amount, over 92 million or 39% was paid directly to the state of California for state-directed programs, and over 142 million was paid directly to cities and counties or 61% for the local efforts at the city and county level. Next slide, please. This is a table that breaks down the previous slide's totals by settlement. So in total, California received payments from 5 settlements and 1 bankruptcy. That's inclusive of distributors, Janssen, McKinsey, Publicis, Mallinckrodt, and then that state cost fund down at the bottom. That's technically 3 payments from distributor, Janssen, and CVS. Distributor paid about 2.2 thousand. Janssen was at about 85,000. And CVS paid about 25,000 to the state cost fund. And we do go over the state cost fund in a little bit more detail in the report, but effectively it is a fund that was created to reimburse states for costs and expenses associated with the litigation and investigations related to opioid matters. In California's case, these payments were provided to the California Department of Justice for their representation of California during litigation. And you can also see here McKinsey and Publicis, those were the 2 state-only payments. State-only agreements. So you'll see that no city or county amount was received for those specific settlements. Again, this McKinsey settlement is the states only. There is a second McKinsey settlement, which we kind of refer to as the class action. That one did result in payments to cities and counties, but effectively DHCS does not have oversight of those payments, so they do not appear and will not appear in our reports. Next slide. The next few slides will go over the state-directed projects. This is the money that was appropriated to state departments in state fiscal year 23-24. Next slide. So a little refresher on the percentage that the state share results in. This is specific to those settlements, so all the ones listed minus Mallinckrodt. It is 15% of the total. There we go. Sorry. These funds must be used for future opioid remediation, and they are paid directly to the state of California for its state-directed projects. Next slide. This slide is this is Mallinckrodt, our only bankruptcy right now. The state share is a bit higher, probably because it doesn't have that subdivision fund in there like the settlements do, but the state share is actually 40%. And that money, again, just like the settlements, needs to be used for future opioid remediation at the statewide level. And the recipient is the state of California, and then it goes on to be appropriated to state departments. Next slide. So here's a little bit of information on how California actually receives its payments. And when I say California on this slide, I mean the state of California and its state departments. So basically what happens first is the company trust or the directing administrator deposits its payment into what's called the Litigation Deposits Fund. This fund is administered by the California Department of Justice. From there, the DOJ may hold back funds for the state's costs for opioid-related investigations and litigation. Additionally, those funds, while they're in the LDF, may accrue interest before being transferred over into the Opioid Settlements Fund. Once the funds hit the Opioid Settlements Fund, they may be appropriated to state departments for opioid remediation projects. Appropriation of funds is subject to California's normal budgetary processes and approved by the state legislature and appears in the official state budget. Next slide. In state fiscal year 23-24, this is kind of the breakdown of the appropriations by state department. So you can see the Department of Healthcare Services was in receipt of the largest chunk at almost $76 million. California Department of Public Health received just over $22 million, and the Department of Healthcare Access and Information received $25 million. Next slide. So out of those appropriations, these are the projects that money was used for. So you can see the majority of those funds went to DHCS's naloxone distribution project, which if you haven't heard, it's a great project. It's been around since about, I think, 2018. And as a quick refresher, naloxone is an opioid overdose reversal drug that is proven safe and effective. Most folks here probably work for an eligible entity that can apply to the NDP for free naloxone. But just a quick shout out, the purchase and distribution of naloxone is an allowable use, and on top of that, it is considered a high impact abatement activity. DHCS also received funding to support the staff and contracted resources needed to continue its required oversight of the settlement funds in California, basically funded this report and this meeting. CDPH received monies to support 3 of their programs, the first one being the fentanyl program grants. CDPH awarded grants to local entities to reduce health inequities for populations that are at the greatest risk of overdose. They also support the California Overdose Prevention and Harm Reduction Initiative. If anyone from CDPH is on the call, forgive me if these numbers aren't updated. Feel free to throw in the chat if they have actually gone up since we created this presentation. But I believe the numbers currently stand at 68 organizations in more than 24 counties through grants to harm reduction service providers. They also have the fentanyl test strip innovation. Funding was actually redirected to the one above that, the California Overdose Prevention and Harm Reduction Initiative, just because that initiative had project goals that directly aligned with the fentanyl test strip innovation, and a contract was already in place. So effectively, that money is still being used for its intended purpose. And then last but not least, we have HCI down there, Healthcare Access and Information. They received $25 million to support the CalRx naloxone access initiative, which was to secure and procure lower cost generic nasal naloxone and to make naloxone more accessible statewide. CalRx branded naloxone is now available through the NDP. There's also a direct to consumer model, meaning individuals can directly purchase naloxone at the same discounted price. More information on all of these projects can be found in the report, as well as our California Opioid Response webpage, which I think may be linked at the end of this. If not, we'll throw it in the chat. Next slide, please. So now we'll talk about that 70%. So this is the largest share that the cities and counties receive. It's actually the largest share that California as a whole receives. So we'll go over some of the expenditure data that we found from fiscal year 23-24. Next slide. So as I mentioned before, the abatement funds make up the largest share of settlement funds provided to California. They account for 70% of all settlement funds and are provided directly to cities and counties from the national administrator. These are the ones that have the high impact abatement requirement, so no less than 50% of these funds received in a calendar year must be used for one or more high impact abatement activity. And they are also restricted to the allowable uses listed in Exhibit E. Next slide. So in fiscal year 23-24, 109 cities and counties reported spending approximately $40,680,000 from the California Abatement Accounts Fund. This number includes more than $40,251,000 in direct Exhibit E costs, or 99% of the total expenditures, and less than $428,500 in administrative or indirect costs, which is about 1% of the total Abatement Accounts Fund expenditures. Next slide. So from those total expenditures, here's a list of the Exhibit E categories and how much was spent in each one. You can see here that treat opioid use disorder accounted for the largest share, marginally, not by a huge amount, but it clocked in at about 22% of total Exhibit E spending from the California Abatement Accounts Fund. Support people in treatment and recovery was a pretty close second. It's at about 18%. And then we have connections to care, which was about 17% of the total spending. The least utilized Exhibit E category from this state fiscal year was addressing the needs of pregnant or parenting women, which accounted for about 1% of spending in total. Next slide, please. Excuse me. So out of those numbers, This slide shows how much was able to kind of meet one of our high impact abatement activities. These numbers are not mutually exclusive with the previous slide. These are kind of just a different way of showing the total expenditures. But we did see that the majority of spending from the California Abatement Accounts Fund was able to be directly associated with one or more of California's high impact abatement activities. So you can see here that the most utilized was HIAA number 3, which is addressing the needs of communities of color and vulnerable populations, including sheltered and unsheltered homeless populations that are disproportionately impacted by SUD. This was followed not so closely by number 2, but HIAA number 2 is creating new or expanded SUD treatment infrastructure. Then we have number 6, which is the purchase of naloxone for distribution and efforts to expand access to naloxone for opioid overdose reversals. And then the last 3 we have are number 1, which is provision of matching funds or operating costs for said facilities within the Behavioral Health Continuum Infrastructure Program, or BCHIP as we lovingly call it. Number 4, diversion of people with SUD from the justice system into treatment. And the least utilized high impact abatement activity category was number 5, which is interventions to prevent drug addiction in vulnerable youth. These high impact abatement activities, minus number 6, can be found in the SSAs. But just a quick note, just because the 6th high impact abatement activity does not appear in certain SSAs, it is an eligible HIA category for all settlement funds. Next slide, please. So now we'll talk about the subdivision fund expenditures for state fiscal year 23-24. Next slide. So a quick refresher, the California Subdivision Fund goes directly to the plaintiff subdivisions who are also considered participating subdivisions. Basically, it goes to kind of a specific subset of our cities and counties. It accounts for 15% of the total settlement payments that are provided to California. These funds must be used towards future opioid remediation and to reimburse past opioid-related expenses. And the key difference here between subdivision and abatement is that reimbursement opportunity, which can include reimbursing litigation fees and expenses. Next slide. Here's a breakdown. If you remember, these are the first 3 are those categories for opioid remediation that are defined in our national settlement agreement. So this is how we essentially make sure that subdivision funds are spent in accordance with the SSAs and the national settlement agreements. So there was a pretty even spread between those first 3. Address the misuse of opioid products was about 40%. The next one was mitigate the effects of the opioid crisis at about 30%, and treat or mitigate opioid use disorder at about 21%. And then the least utilized category also was reimbursing past legal expenses. And one thing to note here too is those first 3 categories are inclusive of future projects as well as reimbursements of past projects. Next slide. Here are the actual amounts that were spent on each of those categories. You can see here, address the misuse of opioid products did account for the largest share at about approximately 40% of funding. In total, there was just under $5 million spent from the California Subdivision Fund in state fiscal year 23-24. Next slide. And now we'll get into the Mallinckrodt bankruptcy. Slight differences in some of the spending requirements and also some of the terminology we use when we explain this. Next slide. So the local government share, those are the cities and counties that are eligible to receive Mallinckrodt payments. It amounts to 60% of the total Mallinckrodt payments. Typically, instead of calling them local governments, they're also kind of referred to in that blanket participating cities and counties kind of term, just to make sure that they're included in the way that we speak about these settlements in bankruptcy. Again, their uses come from Exhibit 4 of the bankruptcy plan, but it is identical to Exhibit E for this settlement. Next slide. So here are the total local government share expenditures for state fiscal year 23-24. We had 31 cities and counties report spending approximately $1.8 million from the Mallinckrodt bankruptcy, which included more than basically over 99% of it was spent in direct Exhibit E costs, with less than 1% or 13,000 spent on administrative or indirect costs. And that is probably due to the fact that the Mallinckrodt agreements are a bit more restricted when it comes to that administrative or indirect cost. They are capped at 5% of the total allocation, which is has less leeway than the DHC policy for the settlement agreements, which is 10%. Next slide, please. Here's a breakdown of the actual amounts. Because Mallinckrodt has some slightly different reporting requirements, NOAT 2 does allow for Schedule A to also be selected as a category when California reports on behalf of its cities and counties. So that's why you'll see Schedule A and Schedule B here. For the settlements in the reporting, we wanted to make it a bit easier, and we were able to identify Schedule A and Schedule B did have basically enough of there was enough in Schedule B to account for everything in Schedule A. Treatment for incarcerated population accounted for the largest share of local government expenditures at about 51%. The next up was leadership, planning, and coordination, which I believe was about 16%. Prevention programs at about 12%. And then at the kind of lower end of the expenditures, we have treat opioid use disorder and connections to care, both at about 6%. And again, the administrative cost for these expenditures was very low. It was less than 1%. And if I remember correctly, it was close to 0.67% of total expenditures. Next slide. Okay, summary and key findings. So we'll wrap up this part of the presentation and then also kind of discuss what we can expect moving forward. Next slide. So here is a little snapshot of where we sat on June 30th, 2024. I will say these numbers over the past 2 years have absolutely ballooned. I think we have crossed over from speaking about our settlement payments in the millions to speaking about our settlement payments in the billions at this point. And that is due to just the influx of new settlement agreements that have been finalized and began making payments in the last couple of years. I think this will be the last opioid settlements report we have with under 7, 8, or 9 settlements that will be accounted for in the report. Next slide. So these are the state-directed projects that we discussed previously. California appropriated $123.7 million in opioid settlement funds to statewide initiatives, including providing grants to increase local efforts in education, testing, recovery, and support services to reduce fentanyl overdoses. That's kind of a catch-all for all 3 of CDPH's state-directed projects for state fiscal year 23-24. And then we have bolstering naloxone distribution efforts within the state through the DHCS naloxone distribution project. And then HCI creating the Naloxone Access Initiative within CalRx to develop a more affordable and accessible nasal naloxone product for Californians. And then continuing statewide opioid settlement fund expenditure monitoring, which goes to support the DHCS staff in collecting, aggregating, reviewing, and analyzing all of the data that we receive from state departments as well as cities and counties. Next slide. One exciting thing that we did see, among the other exciting things we saw in the report, we did see an increase in spending, a pretty significant one among cities and counties in state fiscal year 23-24. It appears that cities and counties transitioned from the strategic planning phase into actual implementation, which drove a significant increase in expenditures. To put that in perspective, we saw more than 9 times the amount of expenditures from state fiscal year 22-23 to state fiscal year 23-24. And not to throw too many, big numbers at you, but in 22-23, cities and counties received over $221 million, but only spent $5 million. These are rough numbers, otherwise we'd be here all day. But that left about $216 million in unspent funds. In comparison, in state fiscal year 23-24, cities and counties received over $142 million, but spent over $47 million, leaving only about $95 million in unspent funds. I think if my math is correct, after state fiscal year 23-24, there would be over $300 million in unspent funds, and that does not include any expenditures that may have occurred in 24-25 or 25-26. It doesn't include encumbered amounts that would be for future projects. But still a very exciting increase. It seems that cities and counties hopefully are getting a better grasp, as well as DHCS analysts, on kind of the nuances and complexities of these funds, and are feeling a bit more confident in spending those funds, possibly after conducting needs assessments to identify local gaps in services and providers at the local level. But regardless, it's very exciting to see more of this money being spent on some things that are obviously necessitated at the local level. Next slide, please. So I know there's a lot of text on here, but these are some innovative opioid remediation strategies that we identified in 23-24 city and county reports. So just to give a brief breakdown, and again, these are explained in more detail in the actual report. But what we did highlight was Sacramento County utilizing funding to design an initiative to assist with OUD at various stages of the criminal justice system and supporting prevention campaigns focusing on cultural orientations. Santa Barbara County utilized funding to expand access to subtreatment for people in custody by strengthening its existing MAP program, and has plans to strengthen its post-release care by increasing prescription length and expanding long-acting injectable medication use. Santa Clara County determined funding priorities through a countywide outreach effort to gather input on needs, gaps, and high-impact opportunities by engaging a broad group of stakeholders, including county agencies, local hospitals, criminal justice partners, contracted providers, and community advisory groups, and ultimately converted their data to actionable harm reduction. Santa Cruz County awarded funds to implement substance use screening for youth in its clinics beginning at age 12, and providers were trained on how to administer this screening tool. They also invested in the expansion of an existing residential treatment program for pregnant and parenting women. And last but not least, Yolo County conducted gap analysis work to establish areas in need of funding by partnering with providers and stakeholders to identify community needs across the continuum of care, and paid for additional recovery residence beds. Again, that doesn't actually cover all of the kind of facets of these projects. So I really encourage everyone here to go through and read those highlights that we've included in our report. And if any of them sound like something you'd like to pursue, that's why we put them in there, and hopefully we can make a connection and kind of get those who are a little shy from spending to communicating with a city or county that has identified something that would work for your city or county. Next slide. All right, looking ahead, reporting expenditures and funds. So cities and counties recently submitted their annual expenditure reports to DHCS for state fiscal year 24-25, and soon will begin submitting their annual expenditure reports to DHCS for state fiscal year 25-26. California and its cities and counties have received payments from additional settlements, which will be included in the state fiscal year 24-25 report. These settlements, and I hope I don't forget any of them, but Allergan, CVS, distributor, Janssen, Teva, Walgreens, and Walmart, I believe all made payments to cities and counties in 24-25. In addition to those, the state of California received payments from Endo, McKinsey, Kroger, and Publicis for state-directed projects. Expenditures are expected to continue rising as cities and counties finalize planning processes and implement activities based on needs assessments. We also hope to see an increase in expenditures because there will be an increase in payments, especially for, if not the last 2 years, but likely the next few years as well, since we're talking about a fiscal year that's already kind of come and gone. But I think so far where we're at right now is there's 11 total settlements providing funding, and there are at least 9 pending settlements that are in various stages of finalization. So you can see that the amount of payments will increase for the cities and counties as well as the state. So that would essentially mean that California is going to be in receipt of more funds than we have seen in the past 2 fiscal years that we've been doing these reports. Additional settlement funds have been appropriated through the state budgetary process in both state fiscal years 24-25 and 25-26. You can click that link there to kind of get some additional information. But spoiler, the appropriations went to the naloxone distribution project, as well as California's behavioral health transformation. Next slide. Okay, I think that is my cue to turn it back over to Chelsea.
Great, thank you, Jenny and Sandy. We will move to our open session for Q&A. Next slide, please. As we transition to the Q&A portion of the meeting, we ask that you limit your questions to topics related to the annual report. If you do have questions about the settlements and background on that context, please feel free to reach out. If you are a city or county, reach out to the OSF inbox or your DHCS analyst with questions that you may have, and they're happy to provide TA. Participants have the opportunity to either raise hands and we will call on you to unmute yourselves, or you can also submit your questions via the Q&A feature on your Zoom control panel. Be aware that if your question needs a little bit more clarification, we may ask you to unmute and provide that additional context. And as a note, we will also provide a follow-up document if there are frequently asked questions that come in this meeting that we're not able to answer today. Next slide, please. Just a few information and resources that we will leave up here for reference as well. As was noted earlier, the DHCS website is undergoing some updates this week, and so those may come in at different times for folks depending on those updates, but we encourage you to check back. Those resources should be available soon. So thank you for your patience on that. And with that, I will go to some of our questions from the Q&A. We don't have anyone with hands raised yet, but please feel free to raise your hand if you'd like to be unmuted. I'll ask the first question, which came from Valerie Gabriel. Valerie asks how everyone is using their funds so far and who in their cities and counties is administering the programs. So hopefully the DHCS team has answered the first question with a lot of detail about how funds were used in this past year. But I was wondering, DHCS team, if you can provide a little bit of perspective about how cities and counties can learn more about who is administering their funds within their jurisdiction.
I'll take a stab at this one. So on the DHCS website, all of the reports that are filed by cities and counties, and just a reminder, we have 2 years of published reports. It's 22-23, which is the first year that payments were administered and expenditures started, and now 23-24. Not only is this larger annual report published, but also each of the cities and counties' individual reports are also published. And so in each of, if you're looking for what's happening within your, a county or what's happening within a particular city, you can link directly to the report to see what activities they're administering. In addition, last year's annual report that was drafted by DHCS and this year's report also have some promising practices in them. But if you're looking for something a little bit more specific, you would want to go directly to the report that was filed by each of those cities and counties. Jenny, I don't know if you have anything you want to add to that.
Yeah, just a quick note. We do also maintain a courtesy list of all the primary contacts. And these are typically the folks that are the ones submitting the city county reports. We have their contact information on our DHCS website. I'm not sure if it includes any titles, but if you're wondering about a specific city or county, that might be a good place to start, is contacting that primary contact.
Great, thank you both. Another question comes from Jill Louie, and she says that bin 26010, Behavioral Health Information Notice, the guidance letter that DHCS put out to help cities and counties with the rules and regulations in terms of spending the settlement funds. She notes that that was helpful, but is wondering about a program that targets people with mental health and/or SUD, whether it qualifies as a high impact abatement activity. So I'm wondering maybe Jenny or Sandy, if you can speak a little bit about how participating subdivisions can engage with their analysts to learn about whether the activities that they have in mind will meet those high impact abatement requirements.
Yeah, I think this is a great question. It's a question that we get a lot. And I'm really actually pleased to hear that the bin was helpful. But going back to our presentation where we mentioned whenever there's expenditures on a high impact abatement activity, they must first meet an Exhibit E activity and then typically be targeting a particular population that's been disproportionately impacted. You'll find in Exhibit E that the majority of the uses are for individuals specifically with an opioid use disorder and or treatment and services for an individual with an opioid use disorder and a related disorder. So there are some restrictions in Exhibit E. It's typically going to be your best place to look before making any decisions on utilizing the funds specifically on high impact abatement activity number 3. Most of the funds are really intended to be used primarily for individuals with opioid use disorders, but there are a variety of activities that are supported in Exhibit E to target populations that are at risk of an opioid use disorder, which could be inclusive. Individuals with primary SUD or other mental health disorders. But again, really just making that connection to whatever activity it is that you're looking to implement within Exhibit E, and then linking that to a high impact abatement activity. Jenny, I don't know if you had anything to add to that.
Yeah, I would say that your best friend is going to be your assigned analyst, because there is, like Sandy mentioned previously in the presentation, we have a very comprehensive TA process set in place. And your analyst is here for that exact reason, basically to kind of get information about the project that you were kind of envisioning. And they will be able to provide kind of more direct answers, because it's never quite a yes or a no. It's a bit more nuanced than that. But that's what they're there for, to kind of help and see if the Envision project is listed in Exhibit E. And then on top of that, if it qualifies for a high impact abatement activity. And it looks like we do have our resources and technical assistance page linked down here on the information and resources page right here. That does list a TA form that you would fill out, and it's basically just a way to get some of your information to the analyst so that they can review. And it's not just that analyst reviewing. I mean, it's a whole team that is reviewing to make sure that it's consistent with guidance we've provided in the past. And it might be kind of a simpler question than you think, right? Because the analysts are really the ones that are going through each and every one of these reports. They've effectively read every single activity description that appear on those reports. So they would be a huge help in that guidance.
And a follow-up question to that is from Ryan Davis. How do you go about finding your assigned analyst?
So the analyst, once the any report is received, they reach out to you directly, and they schedule kind of a quick 30-minute TA session with you. So if you have had a direct line to an analyst in the past, it's safe to assume that is still your direct analyst. If you're new or you're not sure, we have had some turnover in the past, but you can also just reach out to the OSF inbox, and we can get you connected.
Thanks, Jenny, and we'll include that inbox email address in the chat as well. A question from Jax Agar, and they're wondering, have any counties used opioid funds for housing, and how did that align with Exhibit E? So curious if you have any examples of cities or counties in the last year who used these funds in alignment with Exhibit E and their intended opioid remediation purposes, in alignment with housing as well.
I'm going to say that's a tough one just because in addition to reading actual expenditures, we do read planned activities that don't always make it into the expenditure phase. If possible, unless Sandy, you have something to provide here, we might need to take that back and do some digging. Just because, again, there's so many activities we read and they're not all actual expenditures. So I think I would request a little bit more time on that one.
I agree with that, Jenny. Just for awareness for everybody on the webinar is that we receive roughly 300 reports annually from cities and counties, and some of those reports will have multiple activities on them, and so it's very difficult for our team to just extract right now during this webinar, and I apologize for that. But you could, if you'd like, send an email to the OSF inbox, and our team can see if we can pull up some resources for you for cities and counties that are utilizing funds in that way.
Right. Just want to put a reminder that if folks want to raise their hands, we can also unmute to answer questions as well. I will go to another question from Pauline Whelan, and she asks, do hospitals have access to these funds to help treat patients? So again, kind of going back to how can community programs access the folks within their local jurisdiction who are determining the use of these funds, or what community processes may be happening that they could plug into?
I'll take the first stab at this one. So I'm not sure we mentioned this, and if we did, it may not have been mentioned really clear, and I apologize for that. But the funds coming from settlements are administered by a national directing administrator, which currently that's Brown Greer. And then the bankruptcy funds are coming from the trustee. The only funds that DHCS, or I should say the state of California, is in receipt of are those the 15% that are going for state-directed opioid remediation activities. The rest of the money, the 85%, which is the 70 abatement accounts fund, as well as the 15% for subdivision funds, those payments are going directly to cities and counties. And so those are not under DHCS control on how at the local level those funds will be utilized for local activities. So going back to that contact list that's published on the DHCS webpage would provide maybe a local contact for hospitals or anyone for that matter to reach out and look at how funds are being utilized locally and how entities, including hospitals or other programs, might be able to access those funds. I think it's important when advocating to a city or county to say, hey, we're treating individuals with opioid use disorders and we're treating overdoses in our hospital, to really align that with an Exhibit E activity. And unfortunately, it takes just a little bit of homework, but there are a lot of activities listed in Exhibit E, a lot that I think might support the use of funds going to some hospitals for very specific activities related to the abatement of the opioid crisis. But to advocate to get those funds, you would need to go directly at the local level.
All right, looking at a couple of other questions, if the DHCS team is open to some background questions on the settlements. Looks like some folks are wondering about expenditure timeframes. Brandon Sisk asks, is the 5 to 7 year expenditure timeframe a rolling timeframe dependent on the date that abatement funds were distributed to a subdivision?
That 5 year and 7 year for capital outlay projects is from the date of receipt for those funds. Jenny, are we tracking that differently? Like, are we saying it was received within a fiscal year, so it needs to be expended by a fiscal year? Just
Yeah,
wondering.
yeah, I believe we're tracking it based on fiscal year. Our analysts are keeping track of that. We haven't quite gotten to kind of a worrisome date yet, but we are tracking that information and will try to notify anyone ahead of time if that time frame is coming up. I will also say our analysts, we pull from the oldest funds first. This is something we did very intentionally because I don't know if anyone's been here since 2022 when we had our first report. They were separated by settlement, which was, I'll say it, kind of a nightmare, especially considering how that would look now with all the different settlements we have. But our analysts now, they're trained to pull from the oldest funds to reduce that risk of those funds being required to be reverted back to the state. So any oldest funds that are available, we use those first.
So, for example, if a city or county reports they used $1 million specifically for an activity, but when now we're reporting not what did I do with Jansen, what did I do with distributors, we're now just asking for reports to lump the activities from the money from all of those settlements. So, in essence, if there's a $1 million reported activity, but there's 1 million that was received in the previous fiscal year. We're pulling from that first to protect that 5 and 7 year expenditure period. However, it technically would be within that fiscal year that the payments are received. DHCS is really tracking those payments and those expenditure timeframes. And then just a reminder too to everyone, it is encumbered or expended, and so you can encumber funds in an activity. As an example, like drafting a 3 year contract for an opioid remediation activity and reporting that encumbrance. But just remember, if all of a sudden in a year that contract ends and you've still had funds that were originally encumbered in that contract, it reverts back to that original date that you received those payments. So, what we would really encourage folks to do, and really the best thing to do, is the settlements were intended to abate the most immediate opioid crisis that we're having, not just in California, but also across the country. And so really our efforts are always to encourage cities and counties to be spending the money now, because the crisis is happening right now, and people are dying and people are in need of treatment. And so really taking a look at not necessarily the expenditure periods, but what are those activities that we can start to implement now that will have a more immediate impact, and then looking at those longer impacts for funds that are coming in the future. I think it's just important that the crisis is in front of us right now, and we really are encouraging cities and counties to start addressing that.
Another question about the process of receiving funds or opting out of funds. Prapti Ariel asks about the process for redirecting opioid settlement funds that a city has received to the county that that city is located in. So I don't know if the DHS team can speak a little bit about, in the case where funds are already received and then are sent, what is the reporting requirement? And then how can cities, if they choose to in the future, opt out of the receipt of funds? What is the process for that?
Um, I don't think there's an established process for if a city received a payment and was like, whoopsie, we meant to opt out, or we thought that we opt out um, of receiving direct payment, and now we have this money. Um, the best thing to do would be to contract the directing administrator, which is Brown Greer, and find out if there's a process by which that those funds could be returned. They may also ask you just to work directly with the county in which the city is located, to just cut them a check, basically reallocate the funds directly to the county. But Brown Greer may have some administrative things that they need to handle so they can ensure that any payments that went to a city are now redirected to a county. So we would just encourage you to work directly with the administrator to work out the accidental receipt of any payments. All of the settlements allow for the opportunity for a city to opt out of receiving direct payment. And if a city does opt out of direct payment, those funds are automatically then allocated and paid to the county in which that city is located. Also, cities can opt in and out. So if you opted in the past and are now making the decision to opt out, you would contact Brown Greer, excuse me, and then you would need to do that about at least 60 days before the next payment cycle, to let them know that you're either opting out or opting back in to receive direct payment. So hopefully that answered that question.
And I'm gonna sneak in here real quick too. If the city did receive a payment and then decided to reallocate it elsewhere, that is a section that we have on our report. Basically, it was a payment that was received, and so there is a section for you to say, I received this amount, but I gave it to this county or this city. And that I believe would be a reporting requirement for both the recipient that is in receipt of those reallocated funds, as well as the city or county that is reallocating the funds. Not too heavy of a lift. It's just you input the amount, and I believe we have a section indicating which city or county it went to, and then that allows us to check that city or county's report to make sure that it's also kind of identified on that report as well. And it's really just to help us keep track of the transfer of funds, because effectively that would mean kind of more funds in the pocket of another city and county.
Yeah, thank you, Jenny, for covering that, because I did forget that if you want to just simply reallocate funds that you have received, that can be done between subdivisions. Thank you.
Great. I think we're coming to the end of our question list. Just as a reminder, if anyone has a question that they'd like to ask verbally, feel free to raise your hand and we will unmute you. Um, Another sort of maybe bigger picture question for the DHCS team. We've talked a lot about the spending at the local level and requirements for cities and counties, and wondering if the DHCS team can give any insight into looking ahead at the statewide level, how opioid settlement funds will be continued to use for statewide opioid priorities. Any insight about what we can expect in the coming year?
That's a great question. Um, I must say, and say it proudly, is that funds that have been received by the state of California to use for statewide opioid remediation activities have been allocated out to state departments for very immediate needs to address the opioid crisis, and very minimal state operations as it relates to administrative costs. And so really, really happy to see that that's happening at the state level. Important to note that DHCS doesn't make the decisions on the use of those funds. Those funds are subject to the regular budgetary process and determined by the legislature. And so I think right now is we're a little unsure I think current projects have all been funded, and not just funded for particular fiscal years, but they're funded for multiple years. And so I think it'll just be something that we're all anxiously awaiting for. But the state of California and our legislature has done a really good job of ensuring that those funds are used for their purpose. So, Chelsea, I also see a couple questions. Sorry, just wanted to jump in. I think it's Leslie. I can't open the last name for some reason, but said they submitted a request for project review on May 8th. We'll look into that, Leslie, and have somebody respond and provide you an update on the status of that review. As Jenny mentioned, the settlements are very complicated. The proposed activities can tend to be very complicated, especially if they're not very aligned with something that we see in Exhibit E. So they're not just reviewed by the analyst, but also an entire team. And so that might be what the delay is that it's being reviewed by some leadership within the branch. But we'll have somebody reach out to you and at least provide a status update on that. And also there's a question from a Joe Benez, and it looks like you're also wanting to propose a future statewide project. If when you say statewide, if you're referencing the 15% that comes to the state of California, the best way to advocate for that is you can always draft us an email. We maintain a regular list and often submit recommendations for use of the state's portion of opioid settlement funds. And we submit those to department leadership, which are often referred to the governor's office for consideration by the legislature. And so if that's what you're referencing, but if you're looking at proposing a project because you're a city or county that wants to make sure it's an eligible use, just go to our website and follow that technical assistance process.
Just one clarification from a participant circling back to the expenditure timeframes. The participant is wondering, does this mean they have to wait 5 to 7 years to apply that money to an expenditure? And I think just helpful for the DHCS team to clarify that they have 5 to 7 years to expend those funds.
Yes, that's correct. So from the date of receipt of the funds, there's a 5-year expenditure, and we're specifically referencing the 70% that comes from the abatement accounts fund. That's 5 years to either encumber or expend those funds, and unless it's a capital outlay project. So if it's a specific capital outlay project, it would be 7 years to encumber or expend those funds. So you don't wait 5 to 7 years to expend. You only have those 5 to 7 years to expend or encumber those funds.
Great, thank you. We're coming to the end of today's presentation. I think we can go to the next slide. Just want to say thank you again to everyone for joining this webinar on the annual expenditures report. Today's meeting materials will be available within the next week on the DHCS OSF webpage. We'll also send them out via the listserv for the participating subdivisions. And so there's ways for you to join that listserv if you'd like to receive these contacts in the future and receive updates on the settlement funds. Please follow the instructions to be added to that as well. And if you have specific questions about the opioid settlements and bankruptcies, please do feel free to reach out to the DHCS team. They're more than happy to answer your technical questions and help you with any questions that you may have. And the email for that is osf@dhcs.ca.gov. Once again, thank you all for joining and have a great rest of your afternoon.